4, encourage one another and build each other up, just as in fact you are doing. If you are in your clinical fellowship as a speech-language pathologist, I am here to encourage you. Keep going, keep learning. Welcome back to my channel. My name is T.Slater, and I want to share with you 5 things that I think you should chart review if you are a CF-SLP in the medical field. The first thing that I think you should chart review as a CF-SLP working in the hospital is the HMP, the History and Physical Exam. Our lovely physicians take out their precious time to write out these very detailed HMPs. They go, they find out the past medical history for us, they order these tests, these labs, read. It is a lot of good information in there. The second thing that I think you should chart review as a CF-SLP working in the hospital is any imaging involving the head and the neck. By reviewing imaging of the head and the neck, it will let you know clinically how a patient may present. By reviewing the imaging of the head, you will know if your patient had some type of head injury, right? Maybe a stroke, maybe a traumatic brain injury, loss of conscious, anything. And you need to know that information. As well as with the neck, it will let you know if a patient has occluded arteries, if a patient has had a cervical fusion procedure, and that's important information that we as speech-language pathologists need to know prior to going and evaluating a patient. The third thing that I think you should review as a CF-SLP working in the hospital is chest imaging. As a CF-SLP working in the hospital, we are concerned about aspiration pneumonia. We don't want our patients to have aspiration pneumonia. It's good to read the first chest x-ray because you want to know what's going on with the patient, right? Do they have atelectasis? Do they have consolidation? Do they already have pneumonia, right? Then you'll be able to compare that first chest x-ray to any additional x-rays throughout the patient's stay. The fourth thing that I think you should chart review as a CF-SLP working in the hospital is their labs, their lab work. There are 2 areas of the labs that I highly suggest you review. The first thing I want you to review is their WBC, their white blood count. Review their white blood count to see, is there an infection somewhere? The second part of their labs that I want you to review are their neutrophils relative. If this number is high, then the patient probably has a bacterial infection. And what is aspiration pneumonia? It is a bacterial infection. Now, I'm not saying every time these numbers are both elevated that the patient has aspiration pneumonia. However, look at all clinical signs. The fifth thing that I think you should chart review as a CF-SLP working in the hospital is the patient's diet. Chart review to see what the patient's current diet is, especially if you're going in to do a clinical bedside swallow eval. By chart reviewing a patient's diet, it can possibly tell you what type of consistencies the patient can tolerate. Maybe regular solids, could be puree solids, maybe thin liquids, thickened liquids. It will also let you know what restrictions the doctor has recommended for this patient. So maybe the patient is on a low salt diet, right? So maybe you shouldn't take in a saltine cracker, right, to do your evaluation. Maybe the patient can only have so many fluids, right? So don't take in a gallon of water during your evaluation, right? So those are the 5 things that I think every CF-SLP working in the hospital setting should chart review on every single patient. What do you think a CF-SLP working in the hospital should chart review for? Thank you again for tuning in. If you have any comments, drop them below in the comment box. Don't forget to like this video and subscribe. Until next time, bye.